Hi everybody, I'm Jeff Wetzel, President of Bridlewood Insurance. For the last 7 years, UnitedHealthcare has really not brought anything new to San Diego County, but this year they brought a new plan out called the Walgreens plan. Many of you have had this UnitedHealthcare Sharp plan, if it's gone to your Arch doctors, your Sharp Rees-Stealy doctors, your Sharp Graybill. Well, that all comes under this UnitedHealthcare Sharp plan. Well, there's something new that competes this year with it. Really what happened was UnitedHealthcare wanted to come out with what they call a 0-0 plan. 0 copay to see your primary, 0 copay to see your specialist. But actually Medicare would penalize UnitedHealthcare for doing it to the existing plan. But if you created a whole new plan and made the changes there, it's perfectly fine. I think what Medicare is trying to do is give the consumer more options, more choices, and ultimately what they end up doing is making more confusion. So today we're going to kind of walk through it and kind of take some of the sting out of, what's the difference between the two plans. So let's go ahead and we'll take a look at it. So first of all, I want you to reach in your wallet and pull out your UnitedHealthcare card, and just so we're making sure that we're comparing the same plan. So that card should say Sharp in big letters in the top right-hand corner. So if that's the card you have, that's the plan you currently have, this is one that I want you to compare against that I think will be a good one for 2021. All right, so both these plans, both the Sharp and Walgreens plans are called, they're the same name, the same company, just one's Sharp, one's Walgreens. And the other part of it is they're both 0 premium plans, which means that there's nothing monthly to have these particular plans on your to show to your doctor. So think of this insurance as pay-as-you-go insurance. So it really doesn't cost you anything monthly. It's just when you go to the doctor, you pay as you go. So currently you've been $5 to see your primary doctor and $35 to see a specialist. Well, on the new Walgreens plan, the copay is a little bit different. One other thing I wanted to point out before we get into that is the maximum out-of-pocket. So what that means is there's not a deductible, it's a maximum out-of-pocket. What that means is every time you go to the doctor, you pay a $5 copay, $35 to specialist, you spend a night in the hospital, you pay so much copays. If all those copays, every time you reach in your pocket, reach a certain dollar amount, you don't pay any more copays the rest of the year. So it's a dollar limit of protecting your risk. And so if you go ahead and take a look at it on this particular plan, so the Sharp plan you currently have, it's $3,400, where the Walgreens plan has a $2,900 max out of pocket. So it actually decreases your risk by $500 a month. So that's kind of a nice feature to have. Second thing we want to take a look at is your max out of pocket. Obviously is the better plan here. We also want to take a look at primary care visits. So as you can see, the Walgreens plan has a 0 copay to see your primary doctor versus a $5 to see the specialist. And also it has a $35 to see your specialist now, where the Walgreens plan is 0. So that's what I'm saying, it's called the 0-0 plan. So 0 monthly, 0 to see your primary, 0 to see a specialist. So yeah, you can't get much better than 0. So between those, between the max out of pocket, 0 monthly, 0 to see your primary, 0 to see a specialist, and again, all the same Arch doctors, same Graybill doctors, same Sharp Rees-Stealy doctors, they're all exactly the same network, all right? So it's kind of a nice feature to have. So moving on, let's go ahead and take a look at it. So virtual visits, so they've got into that, so now you can take your cell phone, and you can call your doctor and say, Doc, I feel like I have the flu, and the doc can order the medicine for you, and you don't have to get out of bed. You have somebody down to go get your medicine for you. That's a virtual visits they have now. So moving on from there, we can see that inpatient hospitalization is exactly the same. $260 copays for day 1 through 7. And so in that particular regard, day 8, 9, 10, 11 is all 0 after that. So if you do the numbers, it works out to around $1,800. So your worst case, if you had a terrible car accident, you went to the hospital and you spent 30 days in the hospital, you're going to get charged for the first 7, and then everything after that is free. So it works out to be about $1,800. Right? So if we move on from there, you're going to see that skilled nursing, 0 copay, days 1 through 20. It's a little bit different with the Walgreens plan. You'll see day $184 for day 21 to 39 on Sharp plan and day 21 to 36 on the Walgreens plan. It was why 36 versus 39? And it's the lower, remember the lower max out of pocket? So if you multiply that out, you'll hit your $2,900 max out of pocket on the Walgreens plan sooner than you would the $3,400, obviously, on the Sharp plan. Therefore, that's fewer days you'd have to pay for being in a skilled nursing facility. So that's how that works out. Let's go ahead and take a look at outpatient surgery. So currently you have 0 to 250 versus 0 versus Walgreens plan. Well, what is a 0? What does that mean? It means if you have a surgery, outpatient surgery, go in, you have surgery, come home the same day. If the surgery is done at the specialist office, then it's a 0 copay. If you have to go to a surgical center, like you have to have your eyes redone or something like that, then it would be a $100 copay versus the $250 that you have right now. So that's kind of a nice feature to have. Moving on. Let's move it on to diagnostic radiology. So basically that's CAT scans, MRIs. So they're both the same at $95. Lab fees, no charge for lab fees. $10 for x-rays, outpatient x-rays. So you go in, you have an x-ray, you go back home. And ambulance again is the same at $250. Moving on to emergency care. So you'll see that the Sharp plan is $75 versus $90 in the Walgreens plan. Urgent care is $30 copay for both, and you have worldwide coverage. And now what's one thing I wanted to point out? People ask about travel. If we ever get to travel again, will I be covered under this plan? And the answer is yes. So your urgent care, emergency room, and ambulance gives you worldwide coverage. Something new with United this year for 2021. It used to be if you're traveling worldwide, you're in Europe or something, and you have an accident, you end up in the hospital, typically you would have to pay the bill, get an itemized, detailed bill, come back and get reimbursed. Well, now all you have to do is let somebody know that you're overseas, get them in touch with UnitedHealthcare, and they'll take care of your medical bill while you're overseas. You don't have to worry about it. So worldwide coverage, that's kind of a nice feature to have. So if you're traveling, urgent care, emergency room, ambulance, worldwide coverage. All right, let's move on. Let's look at vision care. So you get a free exam every 2 years, $300 off your frames, and $300, free lenses, $300 off your frames or contacts. So dental is kind of nice. You don't have any dental included in the current plan you have. You can add a $12 rider or a $45 rider. On the Walgreens plan, it's a 0 copay for exams, cleanings, x-rays, fluoride treatments, or you could add the super duper plan for $40 a month. It gives you up to $1,500 of coverage. This is interesting because this isn't the HMO network that the dentist is on. This is the UnitedHealthcare PPO dental network. So I went ahead and I put in, Poway, Rancho Bernardo area, and there was hundreds and hundreds of dentists that pulled up on this. So it isn't the standard HMO dentist that you have to go worry about. These are the PPO dentists, and chances are that your dentist is part of this network. So it'll be nice. I mean, it's built in. It's no extra charge on the Walgreens plan. You can go and get your teeth cleaned twice a year, x-rays and fluoride treatment free of charge every single year. Even if, for example, your dentist doesn't accept the plan, it's okay. You could still go in and get your teeth cleaned and x-rays done by somebody that's in network, and then go back to your regular doctor, dentist, to have any work that needs to be done. I kind of make the example, I take my car in to get the oil changed at one of the Jiffy Lube places, but if I need to have some mechanic work done, I don't have Jiffy Lube do it. I take it back to my mechanic and I have him do the work. I take it to the guy that I trust. So anyway, the point is you can get teeth cleanings and x-rays free of charge on the Walgreens plan, and you don't have it on the Sharp plan. So that's kind of a nice feature to have. Let's move on. Let's take a look at hearing. So the hearing's exactly the same. You have 0 copay for a hearing exam and up to $2,075 for hearing aids. Kind of a nice feature to have. Fitness riders, so it does have the Renew Fitness. Many people have the silver sneakers. UnitedHealthcare said, well, here's what happened. Silver sneakers charge UnitedHealthcare as if 100% of their members are using the gym, yet only about 8 or 10% actually do use the gym membership. So UnitedHealthcare said, well, we're not going to do that. We're going to create our own silver sneakers, call it Renew Active. And so we only have to pay for those people that are actually using the gyms, the 8 or 10%. And then we can save the money on the other 90% that don't go, and we can go ahead and add additional benefits with the money that we have left over. So the last few years, they've really added, and I don't know of a gym that's not included in the Renew Active, including YMCA is included in the Renew Active for UnitedHealthcare. And YMCA is about, I want to say $45 a month for a membership there, that now you can get it for free through UnitedHealthcare plan. I mean, that alone is a $500 value. So it's kind of a nice feature to have. Let's go ahead and move on. Transportation. So you have on the Walgreens plan, for no charge, you have 24 one-way trips per year. I mean, that is huge. You don't have transportation on the Sharp plan, but now you do in the Walgreens plan. How many times do people go and they get their eye checked and they get their eyes dilated? You know what? You can't drive home and everybody's busy. You don't have somebody to bring you there, bring you back. Well, now you have that. You can get 24 one-way trips. So if you can get there and somebody can bring you back home, that's great. Or 12 round trips, so you can get one free round trip per month if you want. So you simply have this number. It's called Logistic Care. So you give them a call, say, hey, today is Monday. I have an appointment on Thursday. Can you come pick me up? So they'll come, they'll pick you up, drive you there, drop you off. When you're done, you call the phone number. They come back, they pick you back up, and they bring you back home again. So you get 12 round trips or 24 one-ways per year. Nice feature. Many people get are stuck at home or they don't drive anymore and they want to be able to go see their doctor. Well, now you get the transportation. They bring you to the doctor. You can see your specialist or your primary doctor for no copay, and they pick you back up and take you back home again. So nice feature. Also, if you got to get your medicine, so many times you can get your, you got to go pick up your prescriptions at the Walgreens, for example. You can go there. Many times the Walgreens or the CVS stores or wherever you go pick your prescriptions up is at a place where they have shopping, where they have grocery stores. So imagine you can go get your prescriptions, go pick up some groceries, call them back, and they'll bring you back home again. So they won't take you to the grocery store, they'll take you to your drugstore, but while you're there, all right, you can do your grocery shopping and whatever you need, and then they'll take you back home again. So it's kind of a nice feature. If you know how to work the edges a little bit, you'll come out well on this. Moving on, chiropractic. So if you're good out and you throw your back out, current plan, you don't have any chiropractic. On the new plan, you do. So nice feature, something that we didn't offer before that we do now. So you get 12 chiropractic visits per year, and you also have many chiropractors to choose from. Over-the-counter benefit. So the over-the-counter benefit is if you went into the drugstore and you needed Band-Aids or shaving cream or toothpaste or toothbrushes or vitamins or any of the things you'd normally get over the counter, you can now get through your Medicare plan free of charge. One of the downsides or one of the perks that Sharp plan has over the Walgreens plan is that it's $80 every 3 months on the Sharp plan versus $40 every 3 months on the Walgreens plan. So many people have told me they have a hard time spending $80 every 3 months because they don't go through $80 worth of vitamins every 3 months, and so there's only so many things you can order. So now that's one of the, so if you don't use it that much, it doesn't make a big deal. So anyway, that's the over-the-counter. I'll put a check mark by the Sharp plan. Last thing is the personal response emergency system, the thing that I've fallen and I can't get up. So if you have one of those through the Sharp plan, it's about $40 a month service that it's free through the Sharp plan. I know the Walgreens plan doesn't offer it. So, I mean, that's one of the little things that Walgreens doesn't have. So anyway, let's move on to the prescriptions. So prescriptions tier 1s and 2s. If you go to the Walgreens plan, as you can see on the right-hand side, you can go to Walgreens and get your tier 1s and tier 2s generics for free. And if you go to any other pharmacy, you pay $10 for tier 1 and $20 for tier 2. So currently what you've had, if you said, I always get my medicine from OptumRx, great, because it's exactly the same on this plan. OptumRx is either mail order service, and because the ID number in your card doesn't even change, by changing plans from the Sharp plan to the Walgreens plan, as far as Optum's concerned, nothing changes because your ID number doesn't even change. So same prescription, same doctor, same ID number. It's just automatic, so everything just keeps right on going. Now, if you want to go pick up your prescriptions locally, I recommend that you'd use the Walgreens plan if you're going to switch to this plan, just because your generics, think about it, you can go get your 90-day generics free of charge by going to the Walgreens plan. You just have your doctor call in the prescription to Walgreens. Many Walgreens have a drive-through, so you can just drive through, you pick it up, and they're free already, so they just hand you your medicine and away you go. So nice, handy, easy. Obviously, they want you using the Walgreens. That's why they co-brand with this plan. You can go to CVS, you can go to Rite Aid, but you're going to get a better price by going to Walgreens. Sometimes if you go to your doctor and it's a one-time thing like a Z-Pack or something like that, you can go wherever you want. The prices are going to be about the same. But it's the everyday medicines that you're taking. If you don't want to use the mail order service, go to Walgreens and get your medicine done there. All right. So we're going to tier 1s and tier 2s. There's no charge for that. If you look at tier 3, it's the same price, $47. Or if you go to the mail order service, it's $131. So if you triple the price, take $10 off. That's where you get your price on that. If you look at the select insulins, so UnitedHealthcare is participating in the insulin program this year. So all your insulins or select insulins will be $35 a month, no more than that. So that's one thing that our government did well for us this year, put that into place. Tier 4, as you see, is the same, and also the tier 5 level medicines. You pay 1/3, they pay 2/3. So that's kind of a nice feature there. So at this point, if you say, looks pretty good, I really don't see any downside, what is it that I'm missing? What is it? There's always a catch, right? There really isn't any catch. Here's kind of the two things that we saw of it. Obviously, the Sharp plan has $80 per quarter for OTC versus $40 for the Walgreens plan. Also, the Sharp plan has the personal response system, and the Walgreens does not. So those are really the two features. So if you kind of go, I really don't use $80 a quarter anyway, and I don't use the emergency response system, the thing that hangs around your neck in case I fall and I can't get back up. I don't use that anyway, so why not? Think of this decision also as just 1 year at a time. So if you make the change today, you can get this done for 2021. And actually, we can make changes all the way through March 31st of 2021. So don't think like you missed open enrollment. There's extra times that happen. So right now we have a special event going on in San Diego because of the wildfires we had. So we can make changes now. And then Medicare actually has what they call an open enrollment period that goes till March 31st that lets you change plans if you didn't do it during annual election period, which is October 15 till December 7th, right? So if you have inclination, you say, look, I think I'd like to do this for 2021. I'd like to be able to see my specialist. If you see a specialist 3-4 times a year at $35 every time you go, why not keep that money in your pocket? Wouldn't it be nice to go see your specialist? They show them your card and they say, oh, no charge for you, thank you very much, and the doctor will be right with you? Wouldn't that be nice? Well, you can with the Walgreens plan, and there really isn't a big change because the Sharp and the Walgreens plan are basically twin plans. They just have a few extra benefits and lower copays in the Walgreens plan that get you there. So anyway, it's a nice feature to have. So one of the things you want to concentrate on, same doctor, same specialist, same formulary, same ID number in your card. So there really isn't a whole lot of change here. So so don't think like, oh, I wonder if my doctor it is. If your doctor is with Arch Health Partners, you go to Sharp Rees-Stealy, Sharp Graybill, Sharp Community. They're all the same. They all go under this plan. They all work with the Walgreens plan. All right, so nice feature to have. So if you want to speak with one of our Medicare agents, you can certainly do so. Click the red button above, because I'm assuming you're on the Bridlewood VIP page right now. So click on the button that says, I want to speak to the Bridlewood agent. Give us your contact information. We'll have somebody follow up with you. Your information doesn't go any farther than basically me. All right, so all we do is we get you in touch with a Medicare agent. Again, using a Bridlewood Medicare agent doesn't cost you any money. The insurance companies pay us to take care of you. So why try to wade through this stuff on your own when you could have a licensed, trained Medicare agent that knows this stuff backwards and forwards? And plus, when you go through a Medicare agent like Bridlewood, you have an agent as part of called agent of record. So if you have a question or something comes up, instead of sitting on hold with United for 3 hours and get switched to 15 different people, you just call your Bridlewood agent and they can go ahead and go on and speak before you on your account and make sure, what's the problem, or I got this letter, or what is the deal here? I got a card that has my wrong doctor on it. It happens sometimes. We can go in and get that switched for you and get it fixed. So anyway, having a Bridlewood Medicare agent is very important. This stuff is just complicated enough. You don't want to have to wade through it. This is all we do 24/7, 365. So why not use us? So fill out your contact information. I'll assign you a local Medicare agent, and you can go from there, and they'll take good care of you. All right. So I wanted to say thank you. Bridlewood has been named 5 years in a row now best insurance provider for the San Diego by the San Diego Union Tribune, which is kind of a nice feature to have. We are actually have 500 agents. We're in 27 different states, so we do a good job for people, and it's been growing. And I just wanted to say thank you from the bottom of my heart for making Bridlewood number one, obviously number one in San Diego, and one of the biggest and fastest growing Medicare agencies in Southern California. So we work hard, we do a good job, customers come number one. There's absolutely no exceptions to the rule. All we do is we try to do what's best for you and try to squeeze every benefit that we can out of these plans and try to educate you so that you know all the different benefits, where to go, what to do, who to call. And if you have a question, we're always there. We're always here for you. So anyway, if you'd like to make a change, go ahead and fill out your contact information or pick up the phone and give us a call. We are 858-753-7000. We're here Monday to Friday, 8 to 5. We're here for you. So anyway, I appreciate it. Again, it's Jeff Wetzel, Bridlewood Insurance. Thank you very much. I'll see you next time.